Hi, my name is Caroline Lenette. I'm a lecturer in the School of Human Services and Social Work, and I'm also an early career researcher in the Griffith Health Institute. From the time that I was an undergraduate student, I was drawn towards the research stream. I thought my contribution would be to understand the experiences of people who migrate to Australia. Visual research methods are in the field of visual anthropology. They include the use of photography, the use of digital storytelling, and anything that engages participants to use photographs and their own voice in the research process. When I undertook my PhD research with refugee women who are lone parents, we used digital storytelling, so we created some digital stories on their experiences. And when the women showed these stories to other members of their local communities, they were really inspired and they decided to apply for funding as a group to document their resettlement experiences in Brisbane. This area of research will always be relevant. Refugee issues will always be on the agenda in Australian research as conflicts continue to happen across the world and people find themselves in situations where they have no other choice than resettle in another country. So some of the topics that will be relevant in Australian refugee research include how to achieve positive resettlement outcomes, particularly in employment, housing and access to tertiary education, the mental health of people who have been through mandatory detention, and also how to improve community relations with refugee groups. The student population at Griffith is becoming increasingly diverse, and particularly at the Logan campus, the cohort of students from refugee backgrounds is growing year by year. So it is important to keep that topic on the research agenda, particularly to develop international research collaborations, because it will become not only relevant to Australian policy, but also to our students.